1. When designing a training module for licensed alcohol and drug counselors, which principle of adult learning is most relevant to ensure immediate applicability? A. Adults rely on abstract theories for motivation. B. Adults prefer to learn through passive listening. C. Adults are goal oriented and value real world problem solving. D. Adults prioritize entertainment over content. 2. A counselor in training struggles with assessing co occurring disorders. Which mentoring technique best ensures knowledge transfer? A. Assigning lengthy reading materials without discussion. B. Modeling assessments and using reflective debriefing sessions. C. Providing unstructured peer feedback only. D. Relying solely on standardized test banks. 3. When evaluating a practicum student's ability to use motivational interviewing, which evaluation method is most effective? A. Multiple choice test on counseling theories. B. Observation with a structured competency rubric. C. Group brainstorming sessions. D. Written self-assessment without verification. 4. In curriculum development for substance abuse counseling certification, which component ensures alignment with regulatory compliance? A. Personal counselor preferences. B. National and state licensure standards. C. Peer feedback from informal discussions. D. Generic clinical textbooks 5. A supervisee demonstrates difficulty adhering to HIPAA guidelines during client documentation. What is the best educational intervention? A. Discussing privacy casually during a group meeting. B. Assigning a compliance-focused case study with follow-up review. C. Ignoring the issue to maintain rapport. D. Providing only the HIPAA handbook without interaction. 6. Which communication strategy most effectively supports cultural competence in alcohol and drug counseling training? A. Teaching one cultural model as universally applicable. B. Role-playing diverse client scenarios and debriefing outcomes. C. Ignoring differences to focus solely on addiction models. D. Relying on written theory with no practice component. 7. A counselor preparing for certification must evaluate relapse prevention strategies. Which method best assesses applied knowledge? A. Essay questions on relapse theories. B. Case simulation requiring intervention planning. C. Flashcard memorization of relapse terms. D. Multiple choice test with only factual recall. 8. Which adult learning principle is most essential when teaching relapse warning signs to counselors in training? A. Adults are self-directed and need practical context. B. Adults prefer unstructured exploration. C. Adults resist problem-centered learning. D. Adults avoid connecting new content with experience. 9. During mentoring, a senior counselor notices a trainee avoids addressing client resistance. Which mentoring strategy is most effective? A. Ignoring the behavior until the trainee gains confidence. B. Modeling resistance management, followed by role play. C. Assigning unrelated case documentation tasks. D. Providing only lecture notes on resistance. 10. In evaluating skill mastery for certification, which tool is most reliable for assessing a counselor's ethical decision-making? A. True-false questions about ethics theory. B. Observed structured ethical decision-making scenario. C. A multiple-choice quiz on professional codes. D. A peer popularity survey. 11. When developing a certification exam prep course, what is the most important element to include for regulatory compliance? A. Informal discussion groups only. B. Integration of state licensure statutes and practice standards. C. Peer anecdotes about clinical experiences. D. Exclusive use of online flashcards. 12. What is the best evaluation method to assess whether a counselor in training can apply DSM-5 diagnostic criteria accurately? A. Memorization drills. B. Observed diagnostic interviews with standardized clients. C. Ungraded group debates. D. Peer opinion surveys. 13. Which mentoring approach most effectively promotes reflective practice in substance abuse counseling? A. Journaling with guided supervisor feedback. B. Memorization of key addiction models. C. Group quizzes with competitive scoring. D. Short answer questions only. 14. When teaching adult learners to apply ASAM criteria, what principle is most relevant? A. Adults require immediate relevance to their clinical cases. B. Adults prefer unrelated hypothetical scenarios. C. Adults avoid structured guidelines. D. Adults thrive best on rote memorization. 15. Which communication method best fosters effective interprofessional collaboration training for certification candidates? A. Didactic lectures only. B. Case conferences with active role participation. C. Silent reading of policy manuals. D. Written quizzes on team dynamics. 16. During evaluation, what is the best method to test a candidate's ability to establish therapeutic alliance? A. Multiple choice theory exam. B. Observed role play with standardized clients. C. Group presentations on alliance principles. D. Reading summaries of alliance models. 17. A supervisor wants to measure how well a trainee integrates evidence-based practices. Which evaluation approach is most appropriate? A. Reviewing clinical notes for alignment with best practices. B. Asking multiple choice theory only questions. C. Administering vocabulary recall tests. D. Listening to peer anecdotes without validation. 18. In curriculum development, which strategy best ensures learner engagement for adult professionals? A. Linking learning objectives to real client scenarios. B. Using only abstract theory with no examples. C. Providing unstructured content with no goals. D. Repeating the same lecture format regardless of learners. 19. What is the most effective communication strategy when teaching crisis intervention skills to adult learners? A. Demonstration followed by learner practice with feedback. B. Reading long technical manuals only. C. Assigning passive video watching. D. Distributing fact sheets without practice. 20. Which regulatory compliance issue must always be integrated into counselor certification training? A. HIPAA confidentiality and ethical documentation standards. B. Personal counseling preferences of instructors. C. Informal peer traditions. D. Non-regulated regional customs. 21. During mentoring, what is the best strategy to help a trainee recognize countertransference? A. Supervisor modeling and guided self-reflection. B. Ignoring the issue until the trainee develops independently. C. Assigning multiple-choice ethics quizzes only. D. Recommending casual peer discussions. 22. Which evaluation tool best ensures reliability in testing diagnostic interviewing skills? A. A standardized skills checklist during observed interviews. B. Oral tradition passed through anecdotes. C. Group brainstorming without criteria. Self-report only. 23. In adult learning, which motivational strategy most effectively promotes retention among counselor candidates? A. Connecting course content directly to professional advancement. B. Avoiding links to learners' career goals. C. Limiting autonomy and application of skills. D. Providing only extrinsic rewards. 24. A supervisor notices a trainee overuses confrontation techniques with resistant clients. Which mentoring action is best? A. Role-play alternative strategies with feedback. B. Avoid discussing confrontation to maintain rapport. C. Provide written material without supervision. D. Rely solely on group peer advice. 25. In curriculum development, which factor most enhances knowledge application in alcohol and drug counseling? A. Incorporating experiential learning, such as case simulations. B. Delivering long lectures with no interaction. C. Relying on memorization drills only. D. Using repetitive worksheets. 26. When evaluating candidates' ability to handle ethical dilemmas, what assessment method is most valid? A. Case-based scenarios requiring justification of choices. B. Matching terms with definitions. C. Group guessing games. D. Memorization of ethical codes only. 27. Which communication technique is most essential when training counselors to de-escalate crises? A. Active listening and reflective feedback. B. Reading definitions aloud. C. Memorizing textbook passages. D. Avoiding emotional engagement. 28. In adult learning, how should instructors address learners' prior experiences in addiction counseling? A. Use them as valuable resources for discussion and application. B. Ignore them to avoid bias. C. Discourage sharing to maintain uniformity. Replace them with generic case examples. 29. A supervisor wants to mentor a trainee in professional boundaries. Which approach is most effective? A. Case discussion with role play and corrective feedback. B. Avoidance of sensitive topics. C. Assigning boundary theory chapters only. D. Encouraging peer-led debate without supervision. 30. Which evaluation strategy most accurately measures integration of cultural competence into counseling practice? A. Observed practice with diverse standardized clients. B. Multiple choice quizzes on cultural terms. C. Group sharing with no evaluation. D. Memorization of cultural facts. 31. In curriculum development, what is the most critical step to ensure accreditation approval for certification training programs? A. Alignment with accreditation body standards and documentation. B. Reliance on instructor preference. C. Informal peer feedback. D. Using only past program models. 32. When teaching relapse prevention planning, which instructional strategy is most effective for adult learners? A. Guided case planning with immediate supervisor feedback. B. Memorizing relapse-related terminology. C. Reading textbook chapters only. D. Watching videos passively.